For years, a diagnosis of small cell lung cancer was considered one of the toughest to face. Small cell lung cancer is not only fast growing, but it's also aggressive. And with limited treatment options, it was once seen as a death sentence. Not anymore.
No, thanks to advances in research and clinical trials and new therapies, there is finally real hope for patients with small cell lung cancer. Treatments are improving, people are living longer, and the outlook is changing. Here's a glimpse of a recent LCFA Hope with Answers podcast all about small cell lung cancer.
I'd had 5 lung screenings that were clear until the 6th one, which was not. And that is exactly how my lung cancer was found.
Wow. Do you think the screening saved your life, essentially?
The screening did save my life, without a doubt, Mitch. It was something that I was worried would happen, but you try not to think about it. And when they did tell me that I had lung cancer, they told me it was small cell lung cancer after my biopsy. And I had no idea that there were 2 different types of lung cancer. And when I found out that it was small cell lung cancer and how aggressive that cancer is, if it weren't for that screening, I would not be here today talking with you both.
Yeah. I think it's so interesting because, there's so much that people don't understand about lung cancer and about small cell lung cancer. What's one thing that you think that's really important that you would like to, tell people that you think maybe even your closest family members might not understand about your disease and what you're going through?
I think it's really important for everybody to understand the uncertainty of this disease. It is something that it's treatable, but there's not a cure. And that is why it's so important that we have research in trying to determine what's causing this and find the treatments that will work to stop it, slow it down, keep us living, keep us enjoying life. So that the uncertainty is the main focus that I try not to dwell on. I try to stay positive, and I support the research that is going to give us a cure for this.
For decades, small cell lung cancer has carried one of the toughest prognoses in oncology because it's fast moving, it's hard to catch early, and really challenging to treat. But today, there's real hope. Let's hear from a patient living with small cell lung cancer and a leading oncologist who is also an LCFA grant recipient.
Hi, my name is Montessa Lee, and in 2006, the train I was riding on was derailed when I was diagnosed with small cell lung cancer. So I'm a lung cancer patient advocate for the Lung Cancer Foundation of America, and I'm just so happy to be here with you.
It's very nice to meet you, and it's a pleasure to meet you, Montessa.
Thank you. I know that you're involved in research for small cell lung cancer. Can you tell me a little bit about that?
Sure. It's an exciting time for small cell lung cancer, and that's a sentence you won't hear very often. So small cell lung cancer, let me tell you a little bit more about the disease from a biology perspective. Small cell lung cancer is a very aggressive disease, as you know, and most patients are diagnosed with extensive stage disease. So by that time, they already have metastasis to distant organs. And at that time, the really option for the patients in terms of therapy was chemotherapy for the longest time. And then more recently in 2018, 2019, we had immunotherapy being introduced in combination with chemotherapy for the first-line treatment of small cell lung cancer.
You heard a bit about how Montessa was diagnosed with small cell lung cancer in the last video. Now we take a peek at her real passion, education. With some help from Dr. Seuss, she's doing a great job helping Lung Cancer Foundation of America educate people about lung cancer.
Oh wow, one of my favorite books. Oh, the places you'll go. One of my favorite books to give out at graduation season. And oh, the places I've been on this lung cancer journey as we are welcoming you to World Lung Cancer Day. In 2006, I was diagnosed with small cell lung cancer, and I was in my master's program. I did not know if I was going to be able to finish it at the time. But here, in 2025, I have finished my doctoral program, something I never knew if I was going to be able to do. But we're on the cusp of new horizons, a cusp of new treatment options for patients diagnosed with lung cancer, especially small cell lung cancer. Oh, the places she'll go. I can't wait to see what's ahead of us for lung cancer awareness and lung cancer advocacy. And for me, the next stop might be Capitol Hill for me to advocate for the state of education or lung cancer. If you want to find more about lung cancer, go visit lcfamerica.org. Thank you.